the way that most people know that you become diabetic is through having too much sugar, refined carbohydrates, being overweight, and everything. But that's not always the case. Danny is an example of not being overweight and still having diabetes. Then Martha is another one, not being overweight, but hers came from a different reason. And so, why don't you talk before you even met me? Why don't we talk about kind of like what your lifestyle was, what you were doing? I know that you were. I don't want to overstep my boundaries with personal information, so I'll just let you kind of take it from here and just divulge whatever you feel comfortable with.
Okay. Well, in the last 10 years, I was going through divorce. I had been in divorce court for 10 years, and that was already, like totally chaotic and stressful. But at that time also, my son was diagnosed as schizophrenic, and I was going through emotional challenges with him. And he was going through a lot of challenges, not changes, but challenges with the medications. And of course, I was taking it all in because I was the one that was helping with his anxiety, and I was having anxiety attacks also. And my sugar was up to almost 300. And
But sorry, can I interrupt you real quick? Did
Sure.
you even know at this point, were you diagnosed?
Is diabetic?
Uh-huh.
Yes, I have been diabetic since 2000.
Okay, let's go backtrack to before 2000. What was happening before you were diagnosed? Did the doctor tell you were pre-diabetic? Did he say anything about your sugar levels, or did?
Well, I was feeling kind of dizzy. I had gone to the doctor and I had explained it to her, and she says, "Well, I think your sugar or glucose is high, but let's try to see if with diet, change your diet, start eating more of healthier. That should change quite a bit, and you should see some difference within a month or so." Within a month or so, I went back to her and I said, "No, there's no change. I still feel dizzy. I'm still going through a lot of different changes where I'm getting up in the morning, I'm dizzy and losing my balance." And she says, "Okay, well, let's give you some medication." So from 1 month to another, I started medication. When she told me that it would take 10 years for me to even go on medication. And of course, it didn't happen that way. So I've been taking medication since December 20,000.
So she never even tested you for diabetes or pre-diabetes before she just put you on the medications?
She did. They had I had a glucose count, and they did that serum, the serum before you eat. Is that what I'm saying?
Do you remember if it was a glucose drink? Is that what they gave you? It was like a 75 ounce.
Like some orange drink, like really sweet.
Okay, so that's what it's a standard is 75 grams of pure glucose. So what they were testing. So did they test you several times during a short period of time, or did they just take one blood draw from you?
One time.
Huh. Okay. All right. And at that point, they diagnosed you as being a diabetic at that point?
Yes.
Okay.
And so